have Dr. R.K. Shimpi, a noted professional of andrology, is here with us to sketch a few points towards preventive healthcare from andrology point of view. Sir, can we please have you on stage?
Good morning, ladies and gentlemen. At the outset, let me thank the Times Cyber Media for giving me an opportunity to talk to you about the preventive health. Preventive health per se is defined as measures to avoid disease. So basically, you have to detect it early so you can treat it properly. There are lots of lifestyle diseases like diabetes, hypertension, heart diseases, which if you diagnose initially, you can avoid the complications because of this dreaded disease. I think most of my previous speakers have covered many of the points. So I will mainly talk about the screening programs which we should have in India. And the government should help the public at large to get involved in these screening programs. The simple example I'll give you about the cancer prostate. There's a simple blood test called PSA, and if you do this PSA after 50 years of age, you might be able to detect the prostate cancer at an early stage. When I did my MCH, that time the prostate cancer incidence was very low. In a government hospital, we used to see prostate cancer once in a month or twice in a month. But in my practice now, I see almost 3 to 4 new cases of prostate cancer. Because of change in lifestyle, the change of environment, change of our food habits, the incidence of certain cancers has really increased. In Indian population, the prostate cancer has become the 3rd largest disease killing the men. Now doing simple PSA, and if it is rising to more than 4 nanogram per ml, you will be able to detect prostate cancer, you can undergo surgery, and you will be cured of this. There are other aspects about the screening programs, like for example, the breast cancer, which also you can detect earlier. Now, ultrasound examination is such a simple test and which is available everywhere, even in rural and urban areas. So you might be able to detect certain anomalies by anematograms, and you might be able to prevent that pregnancy where a deformed child can be a burden on the society as well as the family. So the distress caused by diseases or anomalies can be prevented if you diagnose the things at an early stage. Similarly, in corporate sector also, the preventive measures if you take, that improves the behavior of the employee, that improves the overall work productivity, that improves early detection so that the chronic disease treatment required for these employees can be reduced. As that lady told us, the health sector in India is growing very fast, and I think at present it is about $60 billion per year. So I think all of us and the government together should work towards the preventive aspect of this disease, and that will save a lot of money, which will be spent in government hospitals as well as in public hospitals on the chronic diseases. Thank you once again for the Times Media for giving me an opportunity to talk to you about the preventive aspect in health sciences. Thank you.
In category among best andrologist in Pune, the award goes to Dr. Rajendra Kasinath Shimpi.